This is Dr. Matt Lawless bringing you another knee moment from Knee Fit and 5 and MSM products. Today I'd like to talk about robotic-assisted total knee arthroplasty. So total knee arthroplasty is a surgery done for people with arthritis. What a total knee does is essentially resurfaces your knee. So when you get to the point where the cartilage is gone on the ends of your knee, then you get bone-on-bone arthritis. That hurts, and so we do what's called a knee replacement. In a knee replacement, what we do is we cut down through your skin, we divide your muscle, we go into your knee joint, and then we take a saw and remove about 1 centimeter of bone off the tips of your bone here. So we take about 1 centimeter of bone off your femur, your thigh bone, as well as your tibia here. We take those pieces of bone out, and then we put a metal cap on the end, put a metal cap on here, with a little plastic piece in between, and that's a knee replacement. We keep your ligaments on the side intact, we keep your tendons in the front and back intact. We just essentially resurface your knee with metal and plastic. So there's currently a very popular way of doing it with what's called a robot. So the conventional way of doing it is where you use various landmarks, you drill access to the canals, and you put cutting blocks on, and you pin those in place, then make the cut. You make 5 cuts on your femur, you make 1 on your tibia, and then cut for a hole in your tibia to help anchor the base plates in there. You can either use conventional equipment where you, as I said, find landmarks, lock it in place, or you can use a robot. So the surgery is done the same way with a robot or conventional instruments. It's just how the blocks are placed and how the saw is being done. So when you're going to use a robotic assisted total knee, first of all you get some x-rays, you get either a CT, MRI, or x-rays, and you plug that into whatever system. There's different robotic systems out there. You plug that information into the system and you decide, the surgeon decides what kind of cuts, how much is he going to cut off this side of the femur, how much he's going to cut off this side of the femur, how much he's going to cut here, how much rotation. And those are things that have traditionally been done by the conventional way of doing things. Everyone is there's been lots of studies done, and they kind of developed a system where the averages and landmarks let you know where it is. But with a robot, you specifically dial those numbers in, and that's what helps make your cut. So once you have the patient positioned, you've made the incision just like a conventional knee, you've cut down through the muscle and you ended up in your knee, then instead of bringing in your conventional jigs, you bring the robot in, and the robot does either one of 2 things. It either has an arm where the robot makes the cuts with the surgeon controlling when the saw stops and starts, or the other one is where the robot positions the blocks for you. Then you lock it in place and then you make the cuts themselves. So the robot actually helps assist with the cutting, and then the rest is done as conventionally done, where once the cuts are done, the robot's taken out of the way and it's not really used much unless a touch-up cut or something else has to be done. So the thought is that with the robot, the cuts will be a little bit more accurate, and so when you're done with your total knee, the alignment of your knee will be exactly what you're aiming for. If you use conventional methods, there's a small subset of people that have their knee in a little bit of varus, which is in, or a little bit of valgus, which is out, and the robot does seem to help cut down the amount of people that are outliers, meaning that the people that aren't exactly as you mechanically align them, the percentage with conventional outliers is a little bit higher than using the robot. So the robot does seem to make the mechanical alignment a little bit better. Why does that matter? Well, potentially long term it would make a little difference in the survival of the knee. Survival meaning how long the total knee lasts, because if you're blessed to live long enough, then eventually your knee will, in theory, wear out. Right now the 20-year survival rate's probably about 75%, and the hope of using a robot would be to get it even higher. We don't know. We haven't been using a robot long enough. Right now it doesn't look like the medium term or short-term survival is any different between a robot and between the conventional ways. So far that doesn't seem to make a difference in survival. It does make a difference in the accuracy, but not quite in the survival. There's also been some studies which have shown that you may get a little better short-term pain relief and more functional improvement with the use of a robot versus conventional. There's been studies supporting both ways, and it's hard to really determine which way is accurate or not, but it does seem that you may have some little bit less, at least initially, first couple weeks, less length of stay in the hospital and slightly less discomfort. But if you follow those people at 6 months, their outcomes are exactly the same, and at 12 months, the outcomes are exactly the same. Their functional outcomes, their pain relief outcomes seem to be the same. So right now, the robot's a more expensive surgery intraoperatively. You have to buy the robot, you have to buy the pieces that are used to set up the robot to make the cuts. But that is the long and short of the robot. There are some advantages, there are some disadvantages. Either way, you're going to have a good knee. Like I said, at 6-12 months, it doesn't matter which way you had it done, that your outcome is going to be good. So I hope that helps. Thanks.